population health, larger volume, lower touch. And maybe I know here in Canada, we're just beginning into this accountable care and population health. So within a region, we've defined, let's say, 500,000 patients. And we're moving, I believe, to what would be in England, where you have a region and so many doctors. Every person is assigned to primary care. And we're not there yet here in Canada. We have, well, in Ontario, for example, would probably five, six, some estimates say higher, that don't have a primary care physician. And how do we address those needs? And how does virtual care, telemedicine help with that, right? Certainly it's going to be.
Yeah, we see this development all over the world, basically, because um, doctors are very limited resource. We all know that. You can read studies on that. Doctors and healthcare professionals is the group. It's very limited. So how can we improve health of patients in rural area? How can we help patients with chronic conditions? And there I really see digital health coming in place, and also some applications that you can upload on your mobile devices, because mobile devices are not as limited as healthcare professionals. People think that some countries in, let's say, in Africa or in Asia, people do not have mobile devices, but it's not true. They use mobile devices. So the question is, how can we use this technology to help them improve their health as well? And if you use a health patient remote patient monitoring tools and can provide some advice on healthy diet, let's say, or on maybe also on medication, on simple meds that they can buy in their local pharmacy, because
Yeah,
not
yeah.
many countries have like prescription models. So I think this is also a way to improve public health in the sense. And I think, and I we also are asked by some NGOs working in Tanzania or working in Asian regions, and they ask, "Well, so what app would you recommend?" And it's really starting. It's really in the very very beginning. I don't really know what app to recommend, but I see the huge potential, and it's really really interesting. It's yeah.
Yeah, interesting. Again, a myth then we're defining here in our conversation is that telemedicine can't support population health. And in
Yeah.
fact, it may be exactly the opposite, be a wonderful tool to leverage. We're
Yeah.
having some early discussions on how we may be able to, those nations of wealth and high resource. I would be interested in having a whole other discussion with you on this, how we could, say, through academic centers, support those regions that are without, and remote consults, right?
Mm,
Leveraging this virtual technology, synchronous or asynchronous. And I know
mm,
there are some early centers that are doing this, but you have a region in West Africa, Rwanda, or Nigeria that
mm,
is one doc to 40,000 people, right?
mm.
But to have access to radiology, teleradiology, or hematology, being able to give some support or diagnosis, extremely helpful. And virtual and telemedicine could be a wonderful tool, right, to
Mm.
assist in that.
Yeah, that's true. It's really, you don't have to go as far as Rwanda or Tanzania. You can even go to the United States, and we have a huge discussion here on health disparities through digital health. And it's because people are concerned. They say some people would be left behind because they do not use that. And I don't know what experts would say in a few years, but from my perspective, is the key to this problem is teaching digital health literacy. And the same way as you find in the US, in every children museum, information that you shouldn't eat French fries every day because they are not very healthy, and you get information on nutrition, sleep, on digestion, exercise, and so on. And this is what we call health literacy. So understanding what is your health variance, how determines, and how you can, you know, live a healthy life. It's
Yeah,
the same way with the digital health. So you have to understand what are reliable sources, how do health application work, how do they collect their data, do they sell data, is my data protected, it's about data, of course, I'm sorry, but
Yeah, yeah,
but also the technical features of the application, what, how does it help me, maybe, you know, what do I need also. There are very nice tools who offer advice, but maybe some others offer communities. So it's a very, it's just evolving market, but it's very, if we want to make it right, if we want to bridge the health disparities, we have to educate people. And it's about
yeah,
digital health literacy from my
yeah.
perspective.
So there's another myth, right? That digital, virtual, or telehealth is equitable. And really, you have to be careful because right now, you're right. It's not equitable for many parts of our populations. Here
Mm,
in Canada, we would say remote, rural, and our Indigenous populations. Already there was existing inequity,
yeah.
struggles because of those social determinants of health and problems within those communities. And as a result of colonialism and all that we've done with our First Nations people, we could have a whole other conversation on that.
Mm,
Certainly, I'm passionate about that as well. But the connectivity is so important. And how do we get the line out, right, to reach into
mm.
these communities? And what does that look like? It's different rural versus urban. So, yeah, this has been wonderful. And I really appreciate the chat.